Rheumatoid arthritis, understanding, managing, and early warning signs. Rheumatoid arthritis, RA, is a chronic autoimmune disease that affects millions of people worldwide. It can be a painful and debilitating condition. In this article, we will explore the various aspects of rheumatoid arthritis, including its early warning signs, causes, risk factors, symptoms, and more. Learn more about RA management. Introduction. Rheumatoid arthritis is an autoimmune disorder that primarily targets the joints. Unlike osteoarthritis, which is the result of wear and tear, RA occurs when the immune system mistakenly attacks the synovium, the lining of the membranes that surround the joints. This leads to inflammation, pain, and joint damage. Early warning signs. Recognizing the early warning signs of RA is crucial for timely diagnosis and management. Some common early warning signs include morning stiffness. Stiffness in the joints, especially in the morning, can be an early indicator of RA. Joint pain. Persistent joint pain that affects multiple joints, often on both sides of the body. Fatigue. Unexplained and persistent fatigue can be an early symptom. Swelling. Swelling in the joints, accompanied by warmth and redness. Fever. Low-grade fever may accompany the early stages of RA. Signs, risk assessment, and symptoms. Signs. RA is characterized by various signs that become more prominent as the disease progresses. These signs include joint deformities, limited range of motion, and muscle weakness. Risk assessment. Understanding the risk factors associated with RA is essential for prevention and early intervention. The primary risk factors include genetics. Family history of RA increases the risk. Gender. Women are more likely to develop RA than men. Age. Although RA can affect people of all ages, it is most common between 40 and 60. Smoking. Smoking is a significant risk factor for RA. Infections. Some infections may trigger the onset of RA. Symptoms. RA symptoms may vary from person to person but commonly include joint pain, pain and tenderness in multiple joints. Swelling, joint swelling due to inflammation. Stiffness, joint stiffness, particularly in the morning or after inactivity. Fatigue, overwhelming fatigue and weakness. Fever, low-grade fever may accompany the early stages of RA. Causes and risk factors. The exact cause of RA remains a mystery, but several risk factors are associated with the development of the disease. Genetics. A family history of RA can increase the risk of developing the condition. Gender. Women are more likely to develop RA, with hormonal and genetic factors playing a role. Age. While RA can affect people of all ages, it is most common between 40 and 60. Smoking. Smoking is a significant risk factor for RA. The toxins in cigarettes may trigger the immune system to attack the joints. Infections. Some infections may act as triggers, leading to the onset of RA in genetically predisposed individuals. Diagnosing rheumatoid arthritis. Diagnosing rheumatoid arthritis, RA, involves a thorough evaluation by healthcare professionals. Early and accurate diagnosis is crucial for effective management. The diagnostic process typically includes medical history. Your doctor will start by taking a detailed medical history, including any family history of RA or other autoimmune diseases. Physical examination. A physical examination is conducted to assess joint tenderness, swelling, and mobility. Specific joints affected and their severity are noted. Blood tests. Blood tests are essential in diagnosing RA. The presence of specific antibodies, such as rheumatoid factor, RF, and anti-citrullinated protein antibodies, ASPAs, may indicate RA. Imaging. X-rays, ultrasound, or magnetic resonance imaging, MRI, can help visualize joint damage and inflammation. Synovial fluid analysis. In some cases, synovial fluid from an affected joint may be analyzed to check for signs of inflammation. Disease activity assessment. Disease activity scores help determine the severity of RA and guide treatment decisions. Rheumatoid arthritis in children. While RA is often associated with adults, children can also develop juvenile idiopathic arthritis, JIA, a condition that shares similarities with adult RA. Diagnosing GIA in children is challenging and typically involves symptom assessment. Pediatric rheumatologists assess symptoms like joint pain, swelling, and stiffness, as well as other possible indicators, such as fevers and rashes. Medical history. A thorough medical history, including any family history of autoimmune diseases, is considered. Physical examination. A physical examination is conducted to evaluate joint involvement and assess overall health. Blood tests. Blood tests may be performed to check for specific markers of inflammation and autoantibodies. Imaging, X-rays or other imaging studies may be used to assess joint damage. Early diagnosis and treatment are critical for children with GIA to prevent long-term joint damage and maintain their quality of life. Comorbidities associated with rheumatoid arthritis. Rheumatoid arthritis is not an isolated condition, and it can lead to various comorbidities. Common comorbidities associated with RA include cardiovascular issues. RA is linked to an increased risk of heart disease and stroke. Inflammation may contribute to cardiovascular problems. Osteoporosis. RA-related inflammation can lead to bone loss, increasing the risk of osteoporosis and fractures. Infections. Some medications used to treat RA can weaken the immune system, making individuals more susceptible to infections. Lung issues. RA can lead to lung problems, including inflammation and scarring. Depression and anxiety. Living with a chronic condition can take a toll on mental health, leading to depression and anxiety. Real-life stories. Maria's triumph over RA. Maria R., a dedicated teacher, received her RA diagnosis in her late 30s. Initially, the pain, stiffness, and overwhelming fatigue took a toll on her personal and professional life. However, Maria's resilience and commitment to her health led her on a remarkable journey. Through a combination of medication, physical therapy, and lifestyle adjustments, she effectively managed her symptoms. Today, Maria continues to teach with enthusiasm, showing that RA doesn't have to limit one's ability to pursue a fulfilling career and maintain an active lifestyle. John's resilience and advocacy. John E., a retired military officer, developed RA after years of dedicated service. The physical and emotional challenges he faced while managing the condition were immense. Yet, with unwavering support from his family and the dedication of healthcare providers, John regained control of his life. His inspiring journey led him to become an advocate for veterans living with RA. John ensures that fellow veterans receive the care and support they deserve, becoming a beacon of hope for those who have served their country. Emily's athletic journey. Emily D., a young athlete, faced a daunting challenge when she was diagnosed with RA at the age of 20. The condition threatened to shatter her dreams of becoming a professional runner. However, Emily's unyielding determination, a tailored treatment plan, and the unwavering support of her coach allowed her to rise above her diagnosis. Not only did she effectively manage her condition, but she also continued her athletic journey. Emily's story serves as a powerful testament to the fact that life can go on with RA, and dreams can still be pursued. Robert's artistic solace. Robert L., an artist, discovered solace in his creative pursuits after being diagnosed with RA. Art became his refuge, a means to cope with physical pain and emotional turmoil. His artwork not only served as an emotional outlet but also became a source of inspiration for others living with the condition. Robert's journey highlights the healing power of creativity and the strength it can provide during challenging times. Sarah's advocacy for RA awareness. Sarah M., a nurse, received her RA diagnosis early in her career. Instead of allowing the diagnosis to hold her back, she used her personal experience to raise awareness about the condition. Sarah's advocacy work has positively impacted the lives of many individuals, emphasizing the importance of early diagnosis and timely treatment. Her dedication to spreading awareness underscores the significance of proactive healthcare in managing RA effectively. Success stories. Real-life success stories of individuals living with RA can provide inspiration and hope. Here are a few remarkable examples. James, reclaiming an active lifestyle. James R., an avid hiker and nature enthusiast, was diagnosed with RA in his 40s. At first, the joint pain and stiffness threatened to rob him of his passion for the outdoors. However, through a combination of medication and physical therapy, James managed to regain his mobility and continue his adventures. He's a living example of how RA doesn't have to limit one's ability to enjoy an active lifestyle. Lily, pursuing her career dreams. Lily J., a young professional with dreams of a successful career, was diagnosed with RA in her mid-20s. While the initial shock was overwhelming, she persevered. With the support of her healthcare team and a proactive approach to her health, Lily managed her condition effectively. She is now a thriving entrepreneur, proving that RA doesn't have to hinder one's career aspirations. Michael, thriving in retirement. Michael S., a retiree, received his RA diagnosis in his golden years. Initially, the pain and stiffness in his joints threatened to overshadow his retirement. With the guidance of his healthcare providers, he embraced a holistic approach to managing his RA, combining medication, gentle exercise, and dietary changes. Today, he He enjoys a fulfilling retirement, showcasing that RA can be effectively managed at any stage of life. Sophia, defying RA to raise a family. Sophia L., a young mother, faced the challenges of RA while raising her children. She found strength in her family and a supportive community. Through medication and a carefully planned routine, Sophia manages her symptoms and continues to be an incredible parent, proving that RA doesn't have to stand in the way of family life. David, overcoming RA to pursue passions. David G., a passionate musician and artist, was diagnosed with RA in his late 20s. His initial fear that the condition would stifle his creative pursuits was dispelled through a combination of treatment and his unwavering determination. David continues to compose music and create art, demonstrating that RA cannot quell the human spirit's desire for expression. Conclusion. Living with rheumatoid arthritis can be challenging, but with the right support and management, individuals can lead fulfilling lives. Proper diagnosis, treatment, and a proactive approach to health are crucial in managing this autoimmune disease. FAQs. 1. Can rheumatoid arthritis be cured? Rheumatoid arthritis is a chronic condition with no known cure. However, with proper treatment and management, it can be controlled effectively. 2. What are the common medications used to treat RA? Medications for RA management include NSAIDs, DMARDs, and biologics. The choice of medication depends on the severity of the condition. 3. Are there any natural remedies for rheumatoid arthritis? Some individuals explore alternative therapies like acupuncture and dietary supplements, but it's important to consult with a healthcare provider before trying them. 4. Can children develop rheumatoid arthritis? Yes, children can develop juvenile idiopathic arthritis, which shares similarities with adult RA. Early diagnosis and appropriate care are essential. 5. What can individuals do to reduce the risk of developing RA? Maintaining a healthy lifestyle, avoiding smoking, and managing stress are key strategies to reduce the risk of developing rheumatoid arthritis. Learn more about RA management. Your health matters for us. Quali.health